Thank you. Very happy to have the opportunity to speak today. And I'm going to talk about the three things I love. I'm going to talk about theory, I'm going to talk about methodology, and I'm going to talk about data. All right. Huh? Yeah, I'm pushing green and getting no effect. There we go. So I'm going to talk today about strategies for studying person-environment transactions and the implications for understanding and preventing obesity. So I'm going to start with talking a little bit about the epidemic of obesity, and I'm going to emphasize space as well as time in thinking about what's happening. I'm going to critique the way we're approaching obesity. I'm going to talk about the shortcomings of biogenetic explanations and individual psychological explanations. I'm going to present an alternative, a person-environment interaction framework, and talk a little bit about complex systems theory as a different way of thinking about it. Then I'm going to address some of the research challenges we have and talk about three technologies and methodologies for studying person-environment transactions. I'm going to talk about GIS, Geographic Information Systems, GPS, Global Positioning Systems, and Ecological Momentary Assessment. So these are the maps that we're all familiar with, the CDC Obesity Maps, and they're often used to sort of impress us with how rapidly the prevalence of obesity increased in the United States. But we don't often take a look at the geographic heterogeneity in the obesity epidemic. Why is it that, and I think Jean addressed that very nicely, why is it that it's so much more prevalent in the southern states than the western states? So it's not only a rapid development of obesity, it's an uneven distribution. It's a geographic heterogeneity. This is some data from Nashville. These are the average BMI rates by census tract from a random phone survey that we did. And what you can see is that it's tremendously different depending on the neighborhood that you live in. The very green areas, the mean BMI is in the 24, 25 range. The red areas, the mean BMI is 28 and above. So the graph there shows the graph in the corner there shows that we looked at the association between the percent African American in the census tract and the mean BMI, and we saw a relationship there. So we see two things here. One, we see the geographic distribution really differs by neighborhood. We also see the racial and ethnic health disparities that we have in Nashville. This is my favorite slide. I took my camera in my car and I drove around the city and I took pictures of houses. And then I went back and I arranged them in a square around this map of the diabetes prevalence by census tract. I really ended up convinced that I could go to any neighborhood in any city in the United States, and I could look at what the housing was like in that neighborhood, and I could do a pretty good job of predicting the prevalence of obesity and diabetes. There's a very strong relationship here between the social determinants of health, including neighborhood context. So I want to talk a little bit about the way we've approached obesity and understanding obesity. And what we've done is we've seen it as an individual level problem. It's fat people, it's fat individuals. Part of this is driven by the biomedical model. We want to find these biogenetic explanations for obesity. It leads to a clinical paradigm in which we're looking really for diagnosis and treatment at the individual level, and led to a very lot of emphasis on drugs and surgery as the treatment mode for obesity. Psychologists haven't done much better. We've also individualized the problem. We say, yeah, behavior is important, but then we look at the individual determinants of behavior. I think a lot of this really relates to this reductionist paradigm that's been very, very common among the sciences in the US, where we want to take problems, we want to break them down into smaller parts, we want to isolate the mechanisms, we want to take variables and do the independent-dependent variable, hold the context under control, and look for simple, single causal relationships. I think this has led us into a one cause, one cure sort of point of view. We keep looking for the cause of obesity and the cure for obesity. And what I want to argue is that it's multiply determined. There are many causes and many possible interventions that we could look at if we're willing to change our paradigm a little bit. I go back to Kurt Lewin, 1936, for his wonderful human behavior equation. So B is behavior, P is person, E is the environment. And he wrote 3 equations. Behavior could be a function of the person. It's coming from within the organism. The radical behaviorists thought behavior was a function of the environment. It's the stimuli and the reinforcers. And the interactionist paradigm says, no, behavior is a joint function of the person and the environment. In the social sciences, this has led us to social cognitive theory. Health psychologists have developed what we call the biopsychosocial approach. And if you look at public health today, really the dominant framework is what we would call this social ecological framework. It really is a matter of thinking about systems and people being embedded in multiple systems, multi-level adaptive systems. System you can think of as the old phrase, the whole is greater than the sum of the part. And what I think this leads us to is a perspective in which we really need to study the person in context. We need to know the interaction between the person and the environment to really understand obesity. This is from a paper that Sherry Barkin and I published a couple years ago. In the center of the model here is the person in time interacting in the environment. The yellow circle represents sort of the limits of our consciousness, that of which we can be aware, and we're making behavioral choices in this context. Within the person, there are these systems levels that start with, let's say, cognitive affective systems, organs, cells, subcellular genetics, and that these create, because of the multiple interacting and multiple level systems, these create a cascade of causal influences that come to influence our choices. On the other side of the equation, we can look at the environment as well and see that we are not only embedded in an immediate situation where we're faced with choosing food or should we take the stairs or the elevator, we're really faced with living in families, communities, neighborhoods, within political and economic systems, in a region of the country that has humidity and temperature, and all of these create a cascade of causal influences that come to influence the choices we make in real time, and as those choices move us forward through time, it influences our trajectories of weight and weight gain. So my hypothesis is that the obesity epidemic really represents a mismatch between the individual and the environment. We evolved as hunters and gatherers in a set of conditions in which food scarcity was the norm, high levels of physical activity were required for survival. So what did you think of deep fried macaroni and cheese on a stick? Yeah, so we really have evolved an entirely different food system. It's a profit-driven industry. The more you eat, the more money they make. It's driven by marketing and advertising. We've done some amazing things with food, like deep-fried macaroni and cheese. And every year I go back to the restaurant industry's website. Almost half of the food dollar spent in this country is now away from home. It represents a remarkable change over historical trends. Gene did a really nice job, I think, of talking about the transportation systems. If we think about work, machines and electronics have boosted our productivity and reduced the level of physical activity we need. We really live in a very, very different world from the one that our ancestors evolved in. So I'm going to talk a little bit now about the technologies and ways that we can study person-environment interactions. I'm going to talk about GIS, Geographic Information Systems. That's the computer mapping software. I'm going to give you an example of some work that we did with the Nashville food deserts to illustrate that. I'm going to talk about GPS. That's probably what got you to the hotel if you drove. Wonderful way of giving us directions to drive, but it really is a great tool for capturing data, looking at movement and trajectory of individuals through environments, and then talk a little bit about ecological momentary assessment. We'll hear more about that later in this panel. The sort of real-time capture of data on cognition, emotion, and behavior, and I'll give you an example, a fairly simple example of that. So the Communities Putting Prevention to Work was one of those initiatives that came out of the great economic downturn and the stimulus program. Nashville was one of the cities, and I worked with the health department on their project to try to bring more fruits and vegetables to the corner stores. So we developed a food desert map of Nashville, started out with the parcel layer, that is the individual properties. We knew what the utilization codes were. We got the bus stop and bus route layers. We used census data. We derived indicators of sort of housing and people, things like racial segregation and low income. And then we also included data on health outcomes, obesity, hypertension, diabetes. We had variables at different levels of analysis, the parcel, the track, the block group. So we started with the residential parcels. We calculated the distance of each resident to the nearest major grocery store, to the nearest bus stop, and then we brought in 31 other variables from these other layers. We standardized the variables. We calculated z-scores. We summed the z-scores, giving a little bit extra weight to the grocery stores and the transportation. And then we got a set of aggregate scores. We averaged them within the census blocks. And for the 460 census blocks in Nashville, we had scores ranging from -37, which would be a really great, healthy place to live, to +60, which would be a very unhealthy, poor place to live. And we ended up being able to identify 4 food deserts in Nashville. This is the North Nashville food desert right here. We identified one in East Nashville, one a little bit smaller in South Nashville, and then one in an area that's called Edge Hill. And when we talked to people in the community about it, they were just absolutely thrilled. Yes, these are our food deserts in Nashville. I think what's really interesting about this is that this area was really very largely neglected by a lot of people, but it turns out it's a fairly poor, fairly isolated area. If you can see the gray circles, those are the major grocery stores with a mile buffer around them. So that this particular area is just completely unserved. You've got to cross a major expressway to get over to Gallatin Road to get to those grocery stores. I also did this for the entire state of Tennessee. Similar approach, a little bit different set of variables. I couldn't get down to the parcel level to start with. I started at the census tract level. This one incorporates both poverty, access to transportation, density of food resources, and morbidity and mortality. And we were really surprised, I think. Maybe we shouldn't have been, to really understand that the hardest living is really in the rural parts of Tennessee, where people are poor, they don't have good access to transportation, and they don't have good access to food resources. So you can see the Nashville, Middle Tennessee area, Knoxville, Chattanooga, Memphis, Jackson, are all sort of oases of health in a sea of food desert and poor health. So GIS is a cool tool. It provides data to study the environment. There's many sources of data that we can capture, and I want to argue that it's going to really help us sort of quantify this environment side of the person-environment equation. This is another project that we're just kind of getting started on. I'm calling it personal resource mapping, where we're actually gathering data on how an individual interacts with his or her environment using a GPS technology, which we then put into maps with the GIS layers. This is the Q*Z travel recorder. 3 of us wore this for 7 to 14 days. It captured where we were and how fast we were moving at every 5 seconds. We overlaid it over the metro parcel data again. This is where I work in Wilson Hall at the corner of the Vanderbilt campus. And this is all three of us that wore it ended up spending a little bit of time in Wilson. You can see I stagger around like a drunkard at lunchtime looking for food in this map. So we're able to actually then intersect these two layers. And so each dot, when it intersects with a food resource, we can say it was at a grocery store, it was at a restaurant. So that's the way we sort of integrate the two layers. This is just the overall picture of all three of us. We've decided that we were really pretty boring people. I'm the green. I live up here in the corner. I visited a friend and drove to work. The dark one is Nick. He was a summer STEM student. He stayed on campus, but somebody drove him to Walmart and to Target during that time. And then Dr. Novak lives in Brentwood, and she was really boring. She just drove back and forth to work using a couple different routes during this time. This was a graph showing the access to the food resources. I'll say that Dr. Novak went shopping the least. I shopped the most. And she was busted. She was the most likely to visit fast food resources of the three of us. She actually spent the most time still, and turns out I drive the fastest. This is sort of just another way of conceptualizing it. We call this one the wheel. And we see the individual at the center with psychosocial and health needs interacting with these different environmental systems. It's this interaction with the environment that produces health behaviors and produces outcomes. So it's taking the model and saying it's not the individual that gets fat, it's a person-environment system that leads to weight gain over time. So I end up with this ecological momentary assessment. It's a way of trying to capture information about behavior as it occurs in the real world. You can think of three ways of doing this. Event-based recording, so every time I eat a meal, I might capture it. Cued or prompted recording, the device cues you and you record something about the behavior when you get interrupted. Or continuous monitoring, and here I have my two favorite toys up here. This is my Fitbit, and that's my steps over the last 30 days. And this is my Garmin Phoenix, and this is my walking route near the house. I call that the hammer and sickle route. That makes really nice pictures. So this is an HTML5 phone app that we developed to try to capture people's food transactions in the environment. It gets the latitude and the longitude from the Google Maps, and then it allows people to answer a few questions. This was a study that we did with mothers and toddlers looking at their feeding behaviors. We tried out the app with this group. We really learned two things. One, we learned that if you want to understand where these women are getting their food, you have to monitor their husbands. They were doing most of the work. And the second thing was that 1 week is really not long enough to understand how people interact with their food environments. So the challenge, I think, is to step back a little bit from seeing obesity as a disease, as an individual clinical problem, as a failure of self-regulation, as a metabolic disorder, seeing that the cause is not just coming from within, the cause comes out of this person-environment transaction. And I would say really obesity is a failure to adapt healthy behaviors to very complex interpersonal food, transportation, political, social, cultural, and economic environments. And so three sort of types of technology that may be useful: the GIS, the GPS, and the EMA. And just want to end by saying I think there really is value to seeing obesity as the outcome of person-environment transactions. It's going to open us up to many more multi-level intervention approaches. And I really think it's going to expand our understanding of the causal factors in obesity. And I made it with 46 seconds left for questions. So I think we probably have time for one question. Okay, great.
Steve Blair, South Carolina. David, great talk, but I think you made a mistake.
How's that?
It was on that slide that was your favorite slide and all those pictures. And I think you said that you drove around in your car and took those pictures, and you meant to say biked on your bicycle, right?
Well, as you know, we just found out we're one of the poorest towns for bike riding. I actually live 17 miles from my office, and I do bike in from time to time.
I was just teasing you
You're
on
absolutely right. Thank
But
you, Steve.
the more serious question, you talked about the food industry and advertising and the restaurant dollars. Do you think we have strong data showing an increase in caloric intake in Americans and calories per kilogram per day?
The data that I've seen, and a lot of that comes from the USDA, the answer is yes. There's been dramatic shifts in the type and source of food and increases in fat and calorie that have occurred over time. Plus, you see some really dramatic changes in things like beverages. So around 1972, the milk as a beverage and soda as a beverage lines crossed and have been diverging ever since. So I do believe it's not just physical activity, it's a combination of physical activity and feeding that's driving this epidemic. Yes, we have one more question?
I just wondered if you could elaborate a little on how exactly you defined food deserts. I'm still not clear on
It's a composite measure. It includes poverty. So if I look at the map of Nashville, I can find a neighborhood that has no grocery stores, Oak Hills. And my joke is, well, if you run out of food in Oak Hills, you simply send the maid out in the Mercedes to the grocery store. So it really has to do with a combination of poverty, poor access to transportation, and a poor density or distance to these major food sources. So if I put up the graph that showed the corner stores, we would see corner stores in these neighborhoods, but these full-service grocery stores are less accessible. Now, because these things are also highly correlated, I added in the morbidity and mortality data to really come up with, and you perhaps notice I called those the food desert impact areas on the state slide. So again, because these things really do coexist, poverty, lack of access to transportation, poor food resources, and poor health.
And does that include like access to the fast food stores?
Not in the Nashville one, but it did in the state one. Okay. Yeah, I used the 2007 economic census data, which lets me get a density of food resources at the zip code level to integrate with those variables. Yeah.
Dave,
Sure.
I'm really interested in this GPS stuff, but how do we use this in research so it won't induce temporary behavioral change? Or we call it experimental demand effects in
Well,
economics.
we've had that, I think, all throughout all of the history of obesity research, the reactive effective measurement. And essentially, you give somebody a GPS monitor like that, they're really not going to pay much attention to it after the first day or so. Yeah. The regional transportation planning agency is actually using it in their regional transportation plan. They're actually getting a sample.